April is still Esophageal Cancer Awareness Month, and we will continue to talk about what we have to do to not only just find the cancer early, but also to fix it and to give the best chance of cure. So let's talk about what kind of steps happen after someone is diagnosed with esophageal cancer. This is Dr. Raghav here, your OncoCare advisor. Let's say if someone was diagnosed or having symptoms of esophageal cancer or symptoms of difficulty swallowing, nausea, vomiting, weight loss, or symptoms that are suggestive of something is going on in the upper part of the esophagus and the stomach. The first step is endoscopy. Endoscopy means upper endoscopy, or it's also called EGD. So mostly you should be sleeping through the procedure. A gastroenterologist will put a camera into your esophagus and into your stomach and will look at what's going on there. And then they'll take some biopsies. So that's the first step or first test you need to establish a diagnosis. Then I'll talk about two really important things that you need to be aware of. One, once the diagnosis is established, what are the other tests that are necessary, needed to make sure we completely understand this cancer before we start treatment? The second part of it is, who do you all need to see? Who are the more important people? And I always say, who is the captain of the ship? Meaning, who is going to run the show or run the whole treatment plan? Very important. Keep those two things in mind. So the first step is what tests are needed. Once the endoscopy is done, you need something called endoscopic ultrasound. It's called EUS. What it practically means is, if this is a pipe, the camera goes inside and it looks through this wall of the esophagus. By looking through the wall, it helps in two ways. One, it helps us to understand how far the cancer is going through the wall. And second, if there are any enlarged lymph nodes right around the esophagus that we need to do a biopsy to understand if it's spread to those lymph nodes. A very, very important test. But sometimes you can do that ultrasound if the mass is completely blocking the pipe. But this is something, a very critical step that one has to take. The second, CT scans to evaluate for cancer spread anywhere. Or sometimes people go straight to PET scan. A PET scan is something, a very sensitive test, which will identify if there's any cancer present anywhere else. This is important for staging. So these are really, really, really two important tests that you need to ask. Then the second big bucket, which is who do you need to see? I'll tell you this, a surgeon who specializes in esophageal surgeries. You need to ask how many surgeries they perform in a year, and that will give you an understanding of their experience in handling these surgeries. Second, radiation oncologist. Especially if the cancer did not spread anywhere, you need to meet with the radiation oncologist. 3, medical oncologist, someone who administers chemotherapy, someone who talks about chemotherapy, and very important to meet them. 4, a nutritionist. Why? Because it's important that we maintain enough nutrition to not lose any further weight, and also how to handle certain foods, etc. 5, a nurse, as well as maybe a nurse navigator or a care coordinator if you have one, or if the system provides one, is a critical aspect of that. You'll be seeing sometimes radiology, or sometimes you'll be seeing a therapist, you'll be sometimes seeing a speech therapist, but these are the 5 most people. And write down their names, write down who they are, what do they do. Now, you can ask them, see, who is the captain of my ship? Meaning, who makes decisions? Is it the surgeon, radiation doctor, a medical oncologist? Who does? Very, very important. And write it down in a little book. So, let's summarize what we talked about today. First, there are some tests that are necessary once you're diagnosed with esophageal cancer. Endoscopic ultrasound, PET scan. Then, asking who is in your team and who is the captain of the team. I hope this is helpful. If you have any further questions, comments, anything you want me to cover, please comment below and we'll be happy to do that. Thank you. Thank you for following your Cancer Care Advisor.